What I'm about to show you may completely change the way you look at every blood pressure number you've ever written down at home. And if you've ever felt relieved by a normal reading or terrified by a high one, there's something you need to know before you trust either. Because one of the biggest myths in heart health is that blood pressure is a fixed number, like your age or your shoe size. It isn't. It's a moving target. Before we begin, please subscribe to this channel so you never miss life-saving heart advice that could protect you daily. I'm Dr. Aliza Wright, and today I need to show you why a single blood pressure reading can lie to you so convincingly that it changes treatment, triggers panic, or hides real danger. Right now, somewhere, a senior is staring at a monitor that says 172/96 and thinking, this is it, something terrible is happening. Their heart starts racing, their hands shake, and that fear alone pushes the number even higher. And at the very same time, someone else is seeing 124/78 and feeling safe, reassured, almost proud, not realizing that number doesn't reflect what their blood pressure is doing during the rest of the day, during stress, during activity, during sleep, during the hours that actually predict stroke and heart attack risk. That's what makes this so dangerous. Blood pressure can be truthful, but it can also be deeply misleading. And if you don't understand the difference, you can make the wrong decision with total confidence. Here's the truth. And this is the one idea I need you to lock into your mind before this video ends. Your real blood pressure is not one number. It is a pattern across time, across conditions, across repeated measurements, taken the right way. If you don't know the pattern, that number on the screen might be noise. It might be a stress reaction. It might be a posture problem. It might be a timing issue. It might be medication wearing off. It might be a falsely comforting average hiding dangerous spikes. That is why I titled this video exactly the way I did. Don't trust your blood pressure until you know this, because this is the difference between a snapshot and the truth. And medicine should never be built on a snapshot alone. Let me tell you about Eleanor, because her story captures the problem perfectly. Eleanor was 72, disciplined, careful, the kind of person who never missed a medication and never ignored a symptom. One morning she woke up late, realized she had forgotten to call her daughter the night before, rushed downstairs, fed the dog, climbed back up, sat on the edge of her bed, rapped on the cuff, and pressed start. The reading came back 181/102. She froze. She was convinced she was heading toward a stroke. She called her son crying. He called 911. By the time paramedics arrived, sat her down, let her rest, and repeated the measurement properly. Her pressure had fallen dramatically. Not because the danger magically vanished, but because the first number was never a true resting number to begin with. That's the part people miss. And it matters more than almost anything else. Blood pressure responds to movement, urgency, noise, fear, temperature, conversation, even anticipation. When you rush, your body doesn't care that you plan to take a medical reading in 60 seconds. Your nervous system is still activated. Adrenaline is still circulating. Your heart is still pumping harder. Your vessels are still adjusting. So the monitor gives you a real number, yes, but it is real only for that stressed moment. It is not automatically your baseline. It is not automatically the number your doctor should treat. It is not automatically the number that defines you. And this is where so many people go wrong. They confuse an event with a diagnosis. They confuse a spike with a pattern. They confuse fear with certainty. Now, let me show you the opposite scenario because this one is even more unsettling. Samuel was 76, and every time he went to his doctor's office, his blood pressure looked acceptable. Not perfect, but acceptable. 128/80, 132/82. Numbers that didn't raise alarm. He left those visits feeling safe. But at home, he was waking with pounding headaches. In the evenings, he felt pressure behind his eyes. His wife noticed he became flushed and irritable late in the day. When he finally started checking at home, correctly and consistently, his evening readings were often in the 160s. Office looked normal. Home was high. He had what we call masked hypertension. And masked hypertension is one of the most dangerous reasons not to trust a single good reading. Most people have heard of white coat hypertension, where the pressure climbs in the doctor's office because anxiety, rushing, unfamiliar surroundings, and anticipation all push it upward. But masked hypertension is the mirror image, and in many ways it's more dangerous because it hides in plain sight. In that situation, the office number looks normal, while your real-life numbers are elevated when no one is watching. At home, in the evening, during your routine, during the hours your arteries are actually living through. So, when people ask me, "Doctor, which number is the real one, the office one, or the home one?" my answer is always the same. Neither by itself. The truth comes from the pattern. The truth comes when you compare properly measured numbers over time and look for consistency. And there's another layer to this, because even when you do everything mostly right, the first reading is often not the reading I trust most. Let me tell you about Gloria, 69, who used to take one reading every morning and build her entire mood around it. If it was good, she had a good day. If it was high, she had a bad one. But when I asked her to take 3 readings, 1 minute apart, something remarkable happened. The first would be 148 over 88. The second, 137 over 82. The third, 131 over 79. Same chair, same arm, same cuff, same person, just a few minutes apart. Which one was the truth? Not the first by itself. The first was often her transition number, the number her body gave before it fully settled into the measurement process. That's why in proper home monitoring, we care so much about repeat readings. Blood pressure is not a statue. It is a living, shifting signal. The first number may reflect lingering tension, anticipation, a slight posture adjustment, even the stress of hearing the cuff begin to tighten. But when you take 2 or 3 measurements and look at what happens next, you begin to see whether that first number was an outlier or part of a stable trend. This is also why one frightening reading should almost never define your emotional state. It deserves attention, yes. It deserves context, absolutely, but it does not deserve blind trust. A second and third reading often tell a more honest story than the first one ever could. That alone has saved many people from unnecessary panic. Your blood pressure follows rhythms, and your body is not designed to sit at one exact number all day. It usually changes with waking, eating, medication timing, activity, stress, bladder fullness, pain, and fatigue. That is normal physiology. So if you check at random times, you may mistake normal variation for disease progression. Or worse, you may miss a real pattern because the random readings blur it. For most people, the most useful home readings are taken at consistent times, often in the morning before medication and breakfast, and again in the evening before dinner, unless your physician has given you a different plan. Consistency doesn't just make your log look cleaner. It makes your numbers interpretable. And interpretable numbers are the only numbers that can actually help you. Everything else is just digital clutter. Let me tell you about Rose, because her problem had nothing to do with disease progression and everything to do with routine. Rose was 71 and had started watching a cable news program every morning while taking her pressure. She liked to feel informed. She also liked a strong cup of coffee, which she finished right before putting on the cuff. Some mornings, she delayed using the bathroom because she didn't want to miss the opening headlines. Then, she'd sit there, jaw tight, shoulders lifted, listening to upsetting stories, bladder full, caffeine rising, and she'd wonder why her blood pressure was suddenly out of control. Her medications got adjusted twice based on those numbers, but the real culprit wasn't a failing heart. It was the environment she had built around the measurement itself. She was testing stress, caffeine, and urgency, not resting blood pressure. I want you to hear this clearly, because it's one of the simplest corrections and one of the most powerful. If you want a meaningful reading, you have to respect the setup. No caffeine right before, no smoking, no exercise, empty your bladder. Sit quietly for 5 full minutes. No television, no phone conversation, no upsetting headlines, no folding laundry with one hand while the cuff inflates. Create a quiet, neutral moment and let your body settle. I know that sounds almost too simple, but medicine often lives in simple things done consistently. And when you skip that calm setup, you may add 10, 15, even more points without realizing it. Then you don't just get a wrong number. You get a wrong impression of your risk. And wrong impressions have consequences, especially when treatment decisions follow them. Now, let's go deeper, because even with perfect timing and a calm room, technique can still betray you. Arthur, 78, could not understand why his home readings were always lower than the readings in the clinic. He thought his doctor's machine was wrong. He thought maybe the office staff was rushing. Then I asked him to show me exactly how he measured at home. He sat in a recliner, leaned back, held his arm slightly above chest level with no support, and placed the cuff over a light long-sleeve undershirt because, as he put it, it's thin, so it shouldn't matter. But it did matter. The unsupported arm, the raised position, the layer of fabric, all of it was distorting the result. He wasn't measuring his blood pressure. He was measuring a preventable technical error dressed up like medical certainty. This is where people get fooled, because the monitor still gives a number. If it flashed error every time the arm was in the wrong place or the cuff sat over clothing, far fewer people would be misled. But it doesn't. It gives you something precise looking, and precision is seductive. It makes us think the result must be trustworthy. Yet if the cuff is too high above heart level, the reading can look falsely low. If the arm hangs too low, the reading can look falsely high. If the arm isn't supported, your muscles tense, and the number can climb. If the cuff is over clothing, the signal is disturbed. The solution is boring but essential. Bare upper arm, cuff at heart level, arm supported, body relaxed, feet flat, back supported, no talking, no movement. That is how trustworthy numbers begin. Then there's cuff size. And this is one of the most underappreciated issues in home monitoring. Linda was 67, slender, small-framed, and using the standard cuff that came in the box. For 2 years, her readings looked high enough to justify increasing medication. But she felt weak, dizzy, washed out, especially when standing. When we checked her in the office with a cuff that actually fit her arm size, her numbers were dramatically lower. Her home cuff was wrong for her arm, and it had been feeding her frightening, misleading readings for months. On the other side of the spectrum, a cuff that's too small can push numbers falsely high, and a cuff that's too large can distort readings in the opposite direction. So before you trust the screen, trust the fit. If the cuff doesn't match the arm, the number loses credibility. That's why I tell patients not to shop for home monitors the way they shop for a toaster. Convenience matters, yes, but validation and fit matter more. Choose an automatic upper arm monitor, not a finger monitor. And be cautious with wrist monitors unless a clinician has specifically guided you there. Make sure the cuff matches the circumference of your upper arm. If you are unsure, bring the device to your appointment and compare it with office measurements. That one step can prevent months or years of confusion. Because home monitoring is incredibly helpful when it's done right. It can reveal white coat hypertension. It can uncover masked hypertension. It can show whether treatment is working. But it is only powerful when the device and the technique deserve your confidence. Otherwise, you are building a medical story on a shaky foundation. Let me show you another way people get misled, because this one is subtle. Martin, 73, proudly told me he had good blood pressure most of the time. I asked to see his numbers. He had no log, just memory. He remembered the good ones because they made him feel safe. He remembered the scary ones because they made him anxious. He forgot the middle. He forgot the dates. He forgot whether he took them before medication or after dinner or after climbing stairs. In his mind, he had a blood pressure history. On paper, he had nothing. And that's important because the human brain is terrible at remembering medical patterns objectively. We remember emotion, not sequence. We remember surprises, not averages. We remember the number that scared us, not the 40 that quietly came before it. That is why a written log is not optional. A log turns panic into information, and information into decisions. Once Martin started recording date, time, first reading, second reading, and any unusual circumstance, the truth appeared quickly. His pressure wasn't randomly dangerous. It was predictably higher in the evening.